The three biggest mistakes you can make when enrolling into Medicare at 65 are not signing up for Medicare at the right time, choosing a plan that does not meet your needs, and not working with an agent. Let's discuss all three of these mistakes right now. Hey, Andrew Walsh here. I'm an independent Medicare broker helping people across the country with their Medicare choices. If you're new here, make sure to click that subscribe button. And if you ever need any help with Medicare, feel free to reach out to me. My contact information is in the video description below. The first mistake people make is that they do not enroll into Medicare at the correct time. When you turn 65, you have 7 months to enroll into Medicare. This is considered your initial enrollment period. Your initial enrollment period starts 3 months before you turn 65, includes the month of your 65th birthday, and goes up to 3 months after the month of your 65th birthday. You will enroll into Medicare at this time if you are retired or if you have group or employer plan where Medicare is the primary payer. Medicare will most likely be the primary payer if your employer has fewer than 20 employees. Just make sure to check with your benefits department at work to find out if your employer coverage or Medicare will be the primary payer. And if Medicare is primary, you will need to enroll into Medicare during your initial enrollment period. You can enroll into Medicare later if you have credible coverage from your employer and that employer has more than 20 employees. When you retire from your employer, you have a special enrollment period where you have 8 months after you retire and lose coverage to begin Medicare. So missing your initial enrollment period or special enrollment period is where the mistake happens. If you miss your enrollment period, you'll need to wait until general enrollment period that runs between January 1st and March 31st of each year to get onto Medicare. Signing up during this time will make your Medicare effective July 1st. You will then be penalized with your Medicare Part B premium going up 10% for each full 12-month period you could have had Medicare Part B. You will also most likely need to pay a late enrollment penalty for Medicare Part D prescription drug coverage when you finally do enroll into Medicare and a Medicare Part D plan. You pay the Medicare Part D late enrollment penalty if you go more than 63 days without credible drug coverage, and the Part D late enrollment penalty amount is 1% of the national base beneficiary premium for each uncovered month that you did not have a Part D prescription drug plan. So missing your enrollment can really cost you, especially if you wait more than 1 year after you should have enrolled into Medicare. The next major mistake is picking a Medicare supplement, Medicare Advantage, or Medicare Part D plan that doesn't meet your needs. Medicare supplements are the hardest to mess up. Because they do not have networks of hospitals and doctors, the big mistake made with Medicare supplements is missing your initial 6-month open enrollment period where you can enroll into any Medicare supplement plan without health questions. Another mistake is paying more than you should for coverage. Medicare supplements are standardized by letter, so they must offer the same basic benefits. But you could be paying way too much for a plan if you do not look at all the different Medicare supplement companies in your area. Now, you can really mess up when enrolling in a Medicare Advantage or Medicare Part D plan. Medicare Advantage plans have networks, so make sure you pick a plan that covers the network of hospitals and doctors you want in your area. Also, because most Medicare Advantage plans include prescription drug coverage, make sure that the Medicare Advantage plan that you are considering covers your prescriptions at a reasonable cost. Now, if you do need to get a standalone Medicare Part D prescription drug plan that works alongside your Medicare Advantage or Medicare Supplement plan, make sure to shop the market each and every year and pay as little as possible for coverage. You can compare both Medicare Advantage and Medicare Part D plans at the end of each year during the annual election period that runs between October 15th and December 7th. During this time, you can call Medicare or you can go on the Medicare Plan Finder tool at medicare.gov/plan compare. And I will have a video you can click on as soon as this video ends that explains how to use that Plan Finder tool. Or you can use the link in the description and try it out yourself. The last mistake is not working with an independent agent and thinking you can navigate the complexities of Medicare all by yourself. It takes years to understand all the basics of Medicare, and after 7 years, I'm still learning new things about Medicare. So make sure to find a good agent who can keep you on track with your enrollment and help you pick the best Medicare insurance plan for you. All of us agents get paid commission after a sale, and you pay the same amount for coverage whether you choose to go directly to an insurance company or work with an agent. Just always make sure your agent is an independent and represents more than one company so you have more Medicare insurance options to choose between. Now, if you need any help avoiding these 3 mistakes, feel free to reach out to me. My phone number is 920-960-4312, or you can email me at medicarescreenshare@gmail.com. And as always, please like, comment, and subscribe so we can help more people.